Mortality rate. The percentage of people likely to die out of everyone who contracts a disease. It varies widely from one illness to another. To give you a rough idea, COVID-19 has a mortality rate of 1.4%, typhoid 15%, tuberculosis 43%. Marburg virus is so deadly that during the worst outbreak, it killed 90% of those infected. That's a massive rate of fatality. It's an untreatable virus, so once you've got it, there's no cure. One slip up when treating a patient, disposing of their possessions, or conducting an autopsy, and your odds of survival are 1 in 10. And it's not a nice way to go either. The first signs that you've been infected with Marburg are pretty common to most illnesses. They include fever, headaches, sore joints, and rashes. Next comes diarrhea, which can last a week. And on the third day, you can expect to start vomiting with the accompanying abdominal pain and cramps. The diarrhea and vomiting are especially unfortunate as Marburg spreads through bodily fluids. Anyone caring for you in this stage of the illness has a high likelihood of contracting it too, unless they wrap themselves in multiple layers of PPE and douse everything in chlorine. Finally, after worsening for a few days, the internal hemorrhaging begins. You start bleeding from every orifice, and at this point, you're beyond saving. Previous patients have bled from their eyes, nose, gums, and needle puncture wounds. Hemorrhaging can even be seen beneath the skin. Most people die of excessive blood loss and shock 8 to 9 days after the first symptoms begin. It's known as the untreatable disease for a reason. Once you're infected, there's nothing that can be done. Doctors will provide you with pain relief to ease suffering, but there's no cure. The only hope is rehydration and to try and maintain oxygen status and blood pressure. Marburg spreads through contact with bodily fluids of an infected patient. Blood, saliva, vomit, and even urine can be carriers. For this reason, outbreaks are particularly common in rural areas lacking running water and sanitation. Places with poor healthcare facilities are particularly at risk as the sick will arrive and not immediately be diagnosed. Medical staff then won't use adequate PPE and many will contract the disease themselves. One of the features that makes Marburg particularly dangerous is its ability to remain dormant in recovered patients. The virus can survive in the eyes, testes, placenta, and amniotic fluid. This means that the 10% lucky enough to survive the disease can still pass it on many months later, men through unprotected sex and pregnant women to the fetus and through breast milk. It makes it difficult to control the spread as recovered patients can travel to other areas and start new outbreaks months later. Medical staff have to provide extensive education on the importance of using condoms before releasing survivors. However, in many areas, they're not easily available or in common use, which makes the task much harder. Another key risk factor with Marburg is the long incubation period. It can take 3 weeks from exposure to symptoms developing. This means a carrier can be actively spreading in a community or could even travel to another country before they know that they're infected. The Marburg virus first appeared in humans in 1967 in Marburg and Frankfurt in Germany, as well as Belgrade and Serbia. 31 people became ill and 7 died. Of these, 25 were lab workers, 5 medical personnel, and 1 was a family member who cared for their sick relative. The virus had been imported from Uganda in a shipment of African green monkeys. The labs were working on polio vaccines and were using the monkeys to culture kidney cells for research. Unfortunately, some needle stick accidents led workers to be exposed to the blood and tissue of the animals. In one case, a lab worker cut himself while conducting an autopsy. Monkeys are not reservoir hosts of the disease, as although they can be infected, they often die quickly. This means it should be incredibly unlikely for a Marburg carrier to make it all the way from Uganda to Germany. Sick monkeys are not of much use to labs and are usually not sold to them. However, the Ugandan monkey trappers had come up with a way to protect themselves against the financial loss of catching unhealthy animals. They'd start taking all of the sick monkeys they caught to an island in Lake Victoria. They'd leave them there to either die or recover and survive. If ever the trappers didn't have enough monkeys to fulfill a shipment, they'd return to the island and take the healthiest. As Marburg can remain in recovered patients for many months, these now seemingly healthy monkeys were taken but still infectious. When lab workers were then exposed to the bodily fluids, they contracted the disease, and the first human outbreak was underway.